everyone. Welcome back to Dear Editor. I'm Lady George, your host with...
And I'm Precious Basti, your co-host. Welcome back to Dear Editor.
So today we have a fantastic human who is in love with the little ones. Anything kids, anything medical, right, that has to do with kids, she is the go-to person for you. Trust me. Today we have with us Dr. Zainab Yaro, but she's known as Dr. Mims, right? She's a pediatric doctor, and she also owns DMC, which is Dr. Mims Clinic here in Abuja.
Hello, everyone. As Lady George said, my name is Dr. Zainab Yaro, mostly known as Dr. Mims. I'm a pediatric doctor. I'm the medical director at Dr. Mims Clinic and Wellness. And like she said, little humans are my world. So I'm happy to be here.
Thank you. Okay, so today we're here to talk about autism. You know, we need to demystify what autism is. It's still something that people stigmatize a lot, and even parents don't fully understand what it is and tend to treat children who are going through this in a different way. So she's here to shed light on autism for us. So a lot of people are ignorant about autism, right? So I would like you to explain to us from your medical perspective, but in layman terms, what is autism?
Okay, like layman's terms, right? Autism, or the autism spectrum disorder, because you hear people say ASD, is simply a condition that affects how a child's brain processes information. And when that happens, it affects their social interaction, their communication, it can affect their behavior, and sometimes learning. And so they see the world a little differently than the way we do. Simply put, everything is normal structurally, but then just the way the brain interprets the information from the way we interpret it is just a bit different, really.
Okay, so what are some early signs? Because I've been to your space, so I know that this is something that is an integral part of your study, your teaching, and all. So what are the early signs that you would usually tell parents to look out for?
So we've had so many parents ask me, in retrospect, the ones that already have little humans that are autistic, like, what did I do wrong? What could I have seen during antenatal? But sadly, there's really nothing you can do during pregnancy, that journey, whether you had all your classes, you know. But what you can do is pay attention early on, infancy, and that's why we advocate for the wellness checks. So in other parts of the world, like in the UK, at 18 months and 24 months, they do the autism screening naturally. Okay. Once you come in, they screen. If there's a family history, then they screen earlier, right? But something as subtle as a child not making eye contact by the time they're maybe, let's say, 12 months, 18 months, sometimes even as early as 7 months, you expect a child to be making eye contact. They're not making eye contact. A child not responding to their name. That is a very, very key sign. A child preferring to play alone rather than having interactive play. They seem to be in their own world, right? A child that is a bit fixated on certain things, like the child that would like to spin without getting dizzy, can spin for hours. They like to line up things. They usually just use yellow cups, yellow plates, just things like that. So if you see one or some of it, or you just have worries or just tiptoeing, it's always, always better to speak to someone who is a professional, really.
With that in mind now, right? Can you tell us what the difference is between developmental delay and autism?
Where are you getting all these questions? That's an amazing question. I've never had that, coined that way. So yes, so that's where people get it wrong. You indeed have developmental delay. So you can have a boy who gets to 2-3 years not speaking. And the expectation is by 15 months, you're having a few words, right? You're babbling. Even if you're not clear or coherent, you're trying to make conversation. So you can have independent and isolated speech or language delay. And that occurs. And then with just a little bit of help or with time, because not everybody develops at the same pace. Now, where autism comes into play is because the diagnosis of autism, according to the DSM-5 criteria, it has to be a constellation of symptoms and signs, not just the one thing. Yeah, and one delay in isolation. So you have to have a problem in communication, social interaction, Then in areas of repetitive or restrictive behaviors, so like what I mentioned, a child would only eat with certain colors of utensils, or a child would rather just eat things that are dry and crunchy. And then again, you have to have like now sensitivity issues are merged into the other group, but then they have sensory issues like to light, touch, sound. So a child must have one in every category before you make a diagnosis of autism. So a child that is just having speech delay, people just throw it around. I think he's autistic. Or a child that has some sort of social pragmatic disorder in terms of behavior. Decide the way he's behaving, I think he's autism. I think people are beginning to overflock the diagnosis of autism.
So you keep saying he. So is it because you see the cases more in the male than in the female child?
In all honesty, that's even if I try to, because in everything I talk about, I try to balance it out. But in my subconscious, I'm seeing these little humans we're working with, and the pronoun that comes to mind is he, because it's indeed commoner in boys, is 1 in 4, unfortunately.
Oh, wow.
Autism, can it be hereditary? Is it something that can be passed down, like maybe your mom suffered it or your dad suffered it? Is it possible for the child to experience it?
Oh, absolutely, absolutely. And that's why a lot of the links to the cause of autism has been said to be genetic. Not one gene has been identified, but because we've seen it run in families. And the unfortunate thing is, well, it can't be fortunate any other way. It's commoner in boys. So you can have a family where you have 3 brothers, all autistic, or you can have an uncle that was autistic, then his sister's son is autistic. So this shows you that there's a genetic link to it. So yes, absolutely, it is inherited. It can't be inherited, through generations.
So can you explain the spectrum to us? Because some people might just have it to a certain degree, and some it's to a large, obvious degree.
I love that question, because we're trying to make the term severe autism, mild autism obsolete, right? But then it is indeed a spectrum. Why? Because you can have from point A to Z. So let me give you an instance. You can have a boy who doesn't speak, non-verbal, non-vocal, but then if you give him a page or 2 pages, he can memorize it in seconds, or a shopping list, right? He can memorize it in seconds, He can pick out the items just off head, but he doesn't speak. You can have somebody who very verbal, very vocal, not communicating. So it's like, how are you? Oh, the sky is blue. And he speaks almost like a professor, for his age, but then he can't tie his shoelaces. He can't button his shirt. Just daily living skills are absent. So you can have somebody that is heavily dependent on a parent, can't do anything for himself, but then you can have the one that is very independent, but then lacks social interaction. So I think the point the spectrum is trying to make is when you see one child with autism, you haven't seen them all, because it varies in, the degree, the intensity, the dependency when it comes to how independent they can be. So it is indeed a spectrum. You can have the one that is totally dependent and the one that just needs a little bit of support, basically.
So with autism, right, are there some of these behaviors that these kids outgrow, or once they have it, it stays with them for life?
Oh, definitely. That's something that we always talk about. There's something we call maturation.
Okay.
So sometimes when you're doing like a program or intervention for a child, and the little human might improve, and then when you're taking your data, trying to see if this intervention is working, there's something like maturation that will threaten your internal validity, because you're not sure if it was an intervention or this little human just grew older, So we've seen some, and I remember speaking to a mom recently, and she was like, oh, Dr. Mims, you need to see him. He's doing so much better. She was like, but then I think it's because he's older, So of course there are behaviors that, fade out, and then there's some that re-emerge, especially when there are major changes in their lives, like maybe some sort of trauma, or they move schools, or a nanny, something as simple as a nanny leaving. You can see certain behaviors that had been faded out, re-emerging. So yes, with age, some behaviors they outgrow.
So that's some good news.
Yes, definitely.
Okay, so I would like to ask a question. It's a bit controversial, but so there was a video that was trending on TikTok, and a young mom, she's not based in Nigeria, she's based in the UK. She had gone for the diagnosis early on in the pregnancy, and discovered that the child she was carrying had autistic tendencies. And then she wanted to take out the baby, medical conditions, like, it doesn't think that she should do that. Then she eventually gave birth to the baby, and the child was expected. And then there were arguments on TikTok. One person saying, if I go for a test early and I find out that a child is going to be autistic, I would not want to bring that child into the world to suffer and prefer to take. And then everybody was just going back and forth about it. What is what? If you were faced with that kind of
situation. So first and foremost, I haven't seen that video, and I'm very interested to know what kind of test was done. Was it a genetic analysis? Because we do have amniocentesis, how you check for genotype. Because like I said, the diagnosis of autism can be backdated to pre-delivery, right? But there are some genes that are associated with autism, like we've seen in some of the cases. But then that's something I'll need to find out as well. But then now this question, I mean, this is a question, is a dilemma that's in most Western part of the world. In Nigeria, we do know that abortion is illegal unless it's medically indicated. Now, I'll speak as a parent. I remember when I was in med school, I digress a little, and when a woman had a miscarriage at 14 weeks and she was crying, like I would say sorry, but I didn't understand why she was very... But then I got pregnant for the first time, and right with that positive test, I was already attached. And now I want to explain that children who are autistic do not have any abnormality, no abnormal fascia, their organs are intact. So that child has a chance to live full capacity, or like a child with perhaps Down syndrome. So now the onus lies on the mother to make that decision. But as an individual, I think wholeheartedly I would have brought that child into the world because their organs are functioning fine. Although children that are autistic tend to have some comorbidities, some other syndromes. But if with all the checks, everything was fine, I think I would have given that little human a chance, really. I think I would have.
Okay, so let's take it a bit more personal. Why did you decide to become a pediatrician?
So, honestly, I can't say how far back. Recently in our secondary school group, some people are dropping some bits of our yearbook. And I saw my page and I saw pediatrician. I have no recollection of that. But I remember in university, like the whole time in uni, I've always wanted to work with children, to be a pediatric doctor. And one time I dabbled into thinking I wanted to do obstetrics and gynecology. But then very soon I knew that it was about the baby because in the labor ward, I would monitor the labor. Once the baby was out, I disappeared. I abandoned the mother. And I hated other aspects of gynecology. I hated infertility clinic. I didn't like oncology. It was very depressing. But I knew that I wanted to work with little humans. Like I said, they were my people. I don't know, there's something fulfilling about just seeing them come from...
You should see her in her space.
Yes, just coming from being ill, just walking them through to wellness. It's just so fulfilling. They're amazing humans. I can be with them every day, all day, honestly.
So now, you just spoke about support and all, and something came to my mind. This whole autistic, like treatments, therapy, is it covered under NHS?
I say because, I mean, it's not, to begin with, it's not. And there's a huge parastatal here in Nigeria, and at the clinic, they are covering some of our patients for just routine medical issues. And we started having a large number of children who were autistic, and they were being referred to us from this organization. And I had a conversation with the contact persons, the leads, and they said, oh, we're going to cover it. And how these therapies work is a prepaid service. In all fairness to them, they have to make a living. And because we get it post-paid from the organization, you know what? As DMC, part of we'll pay these people up front, knowing that we'll get paid. And I mean, 2 months ran into 4 months, 5 months, nothing was forthcoming.
Oh, wow.
And then I had my contact person reach out, and they said, oh, isn't this like a school problem? This was coming from a doctor who was the contact person. And I said, Doctor so-and-so, like, this is a medical condition. He said, oh no, they have a new management now. It's not going to be covered. So I had to meet the parents individually, one by one, to break the news to them that this is coming. But the ones we've done in the past, they said, oh, we'll pay for that. But then moving on. And a lot of parents had to pull out. They had to pull out because it wasn't covered again. And this is a parastatal that is doing really well. I mean, they have a lot of money. So if at that level it's not being covered, then you can imagine where are we going to start from, really? If at that level, so the government really needs to come in.
Yes, the government, the Minister of Health.
Exactly.
We need the attention on autism because there are a lot of people who are dealing with it, and it's a toll financially, emotionally, and all that. Okay. So in Nigeria, I know with the little research I've done, conversations with you, I know that there's a lot of limitation, right? Even awareness. And if we go into conversations on therapy now, right? What kind of therapies or support do you actually think that we need to find space for in Nigeria?
So bringing it back home as always, it's always heavy for me because people keep saying, I see what we're eating. Is this something in the water, in the air? Why is autism more? And I always say that autism isn't new. What is new is our understanding of it and the awareness. Autism has always been there. And the first thing a parent will usually come to you with is, oh, my child isn't speaking, or this child is autistic, I need speech therapy. But when we do like a pre-assessment consultation, we go on to realize that they have other behavioral issues, like I told you, sensitivity, repetitive behaviors, things that you need to, tackle. And we don't like to use the word fix, because we now have to be the ones to try and understand their own world and try to live in their own world. What we need is more spaces where everything is all inclusive. Because in the past, before I set up, DMC, I had people reach out online. Oh, my child is, autistic. What do I do? And I struggled with trying to get contacts. Was there a speech therapist? Oh, they need behavioral, they need OT, occupational therapy. And I was just sort of like just grasping at just imaginary ropes. Lagos has it better than we do here in Abuja, but we're getting there. More centers are springing up, and that gives me a lot of joy. We had the discussion just before we started about, the school the girls go to. We need centers where everything is all inclusive. We have all sorts of therapy, speech, behavioral, occupational, sensory, physiotherapy, all in one space with people that understand, people that are compassionate and patient.
Very.
In our world, if you don't have patience, you shouldn't even be in that field.
Yes.
So in that field, you have to be extra patient and be there because you want to, not because you're going to get paid at the end of the month. And we need political will. That's like, I think we have to have a conversation around that, because I see things about sickle cell, things about cancers, but nothing about autism. Nothing about autism, honestly.
So essentially, we need people who would ensure that some of these things are put in place in policy and not just in, social media gimmicks.
You just nailed it, because I always say that what these little humans need is not pity. They need policies, they need programs, they need people who care.
Yes.
That's just the most important, because you see people on social media making it like a sensation. Oh, this, and put up pictures, and that's not, they don't need your pity.
Yes.
They need good policies in place that will,
I think we focus more on awareness
more than action.
So what we're taught as medics is, if you're going to create an awareness for something, you have to provide a solution. If not, don't even do it. If I'm going to provide screening for hepatitis and awareness, I should provide a solution. So if I test you and you're positive, what next? It's awareness, all this outreach is a whole package. You don't just come and say, we're talking about HIV, AIDS. So what next? So if I find out you're positive, am I going to link you up to where you can get your meds or get further testing? So it's a whole package. So it's not enough to sit, with a mic behind and then just say, oh, I'm telling you about autism. When you come to me and you have that problem, can I offer solution?
So please, we're also speaking to people in government. Please find a place for people with autism. So grace. I think grace is top, because compassion and everything come under grace. So yes. So now this is for parents, right? What is your message to parents who might be in denial or afraid of diagnosis?
If you're listening, if you're watching this, and there's a small part of your subconscious or that has always suspected that there might be a problem, or you're worried about certain things your little human is doing, I'm here to tell you that you should not panic, you should not delay. Rather, you should seek help from the right spaces, from the right people. Because like I've said, early intervention is very key. We've seen amazing success stories. This is not the time to listen to the people that say it's spiritual, the child is being stubborn, or it's bad parenting. This is the time to block out the noises and listen to or follow that internal compass that guides you to the right place, which is seeking answers for your little human timely. please do not delay, please do not hesitate, and please do not shy away from it. The diagnosis is the first step through the journey of recovery for your little human.
Yes. And we should also remember that it is not about us, it is about the child.
Thank you.
Because the quality of therapy and good advice that you get from a professional would actually impact on your child having the best quality of life instead of suffering and staying in silence, right? So what are the early signs that parents and caregivers should actually pay attention to?
That question is it's a very good question, because with things like autism, early intervention is very key. Very, very key. So in other parts of the world, like in the UK, they do like wellness checks, and that's what I try to replicate at DMC. So at 18 months and 24 months, you do routine screening for autism. If there's a risk in the family, you do it earlier, or if a parent suspects. Now, there are things like your little human not making eye contact. The natural thing is, if you're bonding with your little human, you're looking them in the eye, not making eye contact, you're calling your little human, they're not responding to their name. And most parents will even come to us and say, oh, I really thought she was deaf at some point.
At what age should they respond to their name so that people don't take it the wrong way?
So that's very dicey, because some children, as early as 7 months, you mention their name, they're turning, they know their names. So they're not responding to name. You're in a room, there's so much noise, and then they're just in their own world, preferring to play alone. There are children everywhere. So parallel play, then restrictive behavior, some ritualistic, for lack of a better term, liking to line up toys, fixated on certain things like wheels that are spinning, or they like to spin without getting dizzy, or they like certain textures, only crunchy food or certain colors of food. Then speech delay. Although it's not something you look at in isolation, but most times your little woman is getting to 2 years, getting to 36 months, and they're not even trying to, even if it's incoherent, not trying to communicate, like blah, 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 or trying to say something. That's a red flag. A child that wants something, I wouldn't point. Something as little as pointing is a huge red flag. The child would rather hand lead you or take your hand and put it
on what they want.
That's a red flag. So if you notice, even if that's your first child, if you notice something like that, it's better you speak to somebody professional.
So I also find that a lot of people, we were talking about it before we sat on set, a lot of people get angry if you try to indicate it to them. Like you mentioned, like schools are even afraid to mention it to parents because of how they might react or even pull their kids out of the school, So how do you think it's best for someone to relay that kind of message?
In terms, how people respond to grief differently. I liken it to the same thing as when it's almost like you're mourning the death of a child you gave birth to, the child you had dreams and aspirations that might never come to fruition. So it's actually like somebody had died. Because as a parent, I like to remove myself as a scientist, as a doctor, but as a mom, someone coming to you and telling you that I do think something is wrong. There's a girl that you thought was going to do ballet or was going to do, and you're telling me that she might not attain, those milestones. So the first instinct might be anger or rejection or just denial. And I've seen, I've interacted with a lot of these parents, and I've seen people that have accepted it. Oh, I always suspected it, but now that you're saying it, it makes a lot of sense. What do we do next? I've had people not come to the clinic for a while, and then all of a sudden they're back.
Show up.
And then they're like, what you said, after you said it, I began to notice certain things. So honestly, there's no manual to, but what I always say is you have to be compassionate in the way you say it. I've heard somebody that said, you said you came because your child is not, this child is autistic now. Just plainly put. It's like someone comes with certain symptoms and I say, you have cancer now. You have to ease the person into it. You have to the word is compassion. You have to understand that this is something that's going to turn the person's life upside down.
Yes.
So I excuse any behavior they put up, whether it's anger, whether it's insult sometimes, whether it's denial. I try to still come back and try to bring some. I never get through to them, and that's okay. But I try my best and I give them grace. No matter the reaction, I give them grace.
Have you seen any beautiful examples of inclusion, maybe in schools, communities, and workplaces that give you hope?
Oh yes, I have. And again, back to the conversation we're having. some of the schools don't like me here in Abuja because I call them out, because I feel some of them are very disingenuous in what they tell the parents. But I've seen some beautiful examples, that actually offer inclusion. And what warms my heart is the other little humans in that school are growing up knowing that there are little humans that are like them, but they just behave a little differently, and that's okay. And so that inclusion really, it gives me so much joy, because you see them, you're like, oh no, he doesn't talk, so don't speak too loud, things like that. So things like that. So the schools are intentional, you see, and when they have all these stage presentations, regardless of what the child's behavior, you see them, they have their shadow, and then they're involved in everything. And I remember when I went to Atajuvi, and then I cried because I saw some of my patients on stage. They were graduating, they were in their tuxedos, and there was one that even had a bib that was really, but he was on stage and he was being involved, and I was just bawling my eyes out because it just gave me so much joy, because I knew where we were coming from, and I was very proud of where they were at the moment. So yes, we're getting there, but we need to do it the right way, and that's why I'm always on their neck and trying to make sure they're doing it the right way.
I know, like, the thing is with schools, right, or with kids, if they don't see these things, right? So to them, it's just, oh, mommy, that my friend doesn't really talk like me, but it's okay, right? But as they grow older in society, they begin to see how maybe teachers or caregivers or at a restaurant, how people treat particular kids. So I really feel like you said earlier, we really need to be more compassionate towards people, because our kids are watching, and it is what we're showing them that they tend to do. So please, let's inculcate a lot of compassion. So now, let's talk about stigma, right? How can we move from stigma to understanding autism? Because even some parents stigmatize their kids. I'm sure there are societies in Nigeria, because this is where we are, where maybe they lock their kids up in rooms and abandon them, right?
So it's here in Nigeria, we're still at the phase where families are involved are still talking quietly and whispering about autism. And I think it's time we speak loudly about it. Personal experiences I've had, there's a mom that came into the clinic, and it was a bit filled up that day. She was like, if she had known that it was winter, she should have just not come on that day, because she was bringing her daughter who was autistic, and she actually had to sneak out of the house because the father was not on board that there was a problem. So she was saying, oh, I wish I didn't come at this time when he was busy, because she was ashamed. And I don't blame her, because I could see other parents judging.
Society.
And I get that a lot in the clinic, because I don't segregate them. When they're unwell, they do their vitals in the same space. But I see it in their eyes, and especially if the child is like 7, they're like, at this age, this boy is doing this. And it breaks my heart, because how often would I come to this parent, because I don't say it out loud, because, and say, oh no, he's autistic, he's that. And something as little as wearing this lanyard, some people, oh, it's so colorful, oh, what does this mean? Something like what we're having now. These are the things we need to do, because people fear what they don't understand.
Yes.
And people misinterpret or stigmatize what they don't understand. If they understand that this is what is happening and this is what the parent needs, I think we'll begin to phase out stigma and move from that phase to a phase of understanding and support. Because I promise you, these parents, apart from the financial journey, is such an emotional roller coaster. And the least we can offer is our support, if nothing else.
So what's one small action anyone watching this can take today to make life easier for families and children?
So, like, people that are watching, people that have the ability to do things like this, so the influencers, the people that have spaces where they have a lot of followership on their platforms, can begin with conversations like this. If you don't have a huge platform, you can start in little silos, like in your little pockets. Just educate somebody else, but you need to have the right information from the right sources. So read about it. People always have this behavior, if it's not affecting me directly, then I don't care. You should care, because that's what humanity is all about. So you've heard about autism today. Just, they say if you want to confuse an African, or they say hide something in a book.
In a book, yes.
We don't like to read. I mean, it doesn't have to be a book. It's the digital world now. Just Google it. Listen to podcasts like this. Just try to do your research and educate the next person. And if you ever come across a parent who is working on that journey, please give them grace, be supportive in any way you can, whether it's financially, emotionally, or just by being there and listening. Some of them just want to talk and have somebody listen to them genuinely, not just, I'm here. So these are little things we can do. It will go a long way. And if you know anybody in government, we're begging you, please, our voices need to be heard at the national level, so that these policies can be put in place, because we need it, honestly. We can't do it alone.
Okay, so I'll take the last one, Abby. Okay. The last question, Abby. So if you could just leave our viewers with one key truth and fact about autism, what would that be?
Autism is not spiritual.
I like that.
It's not Obanje. The child isn't stubborn. It's not as a result of bad parenting. The child is not a bad egg. An autistic child is not a retard. I detest that word. An autistic person, because we see it in adults, an autistic person just means that the person sees the world a little differently than we do, or you do. And what you need to do is not try to fix that person per se. I don't like that word. Is try to understand that person's world so that all of us can live, in harmony and in synchronously and all of that. So please, I need you to get those misconceptions out of your mind and relearn. You have to unlearn them and then relearn what is true about autism. And always remember to show them grace. Always.
Okay, so we've come to the end of this episode of Dear Editor, where we had the amazing, you have to meet her in person to understand why I'm going on about it, but the amazing Dr. Mims. And we spoke about autism. So autism isn't about fixing a person, truly. It's just about creating a world that doesn't limit them and a world that understands how they perceive the world. Because even we as individuals, we perceive the world differently, right? So it's the same thing with little ones or even adults, or little ones who have gotten to the adult stage. They just see the world differently and react to the world differently. So please, let's be kind, let's be gracious, and let's be compassionate. Thank you.